Good morning, everyone. Welcome to the webinar. This is Kate Quigley. I am the Lead Resource Specialist and Project Manager with the United Way of Connecticut's 211 service. We are thrilled that so many of you were interested in participating this morning, and we are really excited to share some of our new features of our website with all of you. So I did want to thank everyone for not only your participation this morning, but also those of you who were kind enough to share the link to this webinar with your community partners and your networking groups. That was really, really kind of you. So thank you very, very much. I'm going to let my colleague introduce herself now.
Hi, everybody. This is Annie Scully. I'm a research analyst at United Way of Connecticut, and I just want to echo Kate and say thank you for logging in today. We're excited that you're here to join us. Before we get started, I just want to cover a few housekeeping items. Just so you know, all of you are on mute this morning, so you won't have the opportunity to talk in, but at the end of the webinar, we're going to leave time for questions. So please feel free to chat your questions at any time, and at the end of the webinar, we will address all of those questions. There's also going to be an opportunity for you all to give some feedback after the webinar is over. You'll receive a follow-up email with a link to a poll where we just ask you a quick 4 or 5 questions, and also there's an opportunity to sign up for additional information about webinars and to sign up for our newsletter. So thank you again for logging in, and I'm going to pass the mic back over to Kate, and she'll get us started.
Thanks, Annie. So this morning, we are going to take some time to walk you through our live website. So we're going to do some hands-on searching so that all of you can see the new features. So those of you who are very familiar with our website and who use it all the time, some of this will be refresher for you, but my hope is that there are also some folks on today that are brand new to our website who are really going to get the full scope of everything that you can do on our website. So before I switch over to the live website, I just want you to notice my information and Annie's information here. If at any point after this webinar today you have any questions or feedback for us, you can certainly reach out directly to either one of us at any time. And if a webinar for you and your staff might be something that you want to consider going forward in the future, we can certainly talk to you about that and set something up. All right. So our website is www.211ct.org. So this is our homepage, and I'm going to go through the searching process in just a second, but I want to first give the lay of the land of the homepage so you kind of know where you are and know what to look for. So at the top navigation bar is a little bit about 211, how to get help. There's our professionals page, which Annie's going to speak to a little bit later on. There's a page for our e-library papers, which hopefully I'll get a chance to speak to later. We also do have some chat opportunities, not currently at the moment, but hopefully very soon we will be able to re-engage that chat feature. And then a login feature for the My 211 account, which I'm going to speak to very shortly, and then a sign up button to enable you to just start getting an account. Up here at the top is our banner where we keep timely information. We just recently took down the banner for tax preparation assistance. If there was a disaster in Connecticut right now, we would have information about that up here. This one relates to the disasters in the fall with the hurricanes. We do have some information about the My 211 account feature and all of our updated features in the banner. First off, up here at the top right, there's a little globe. You can translate our site into any one of these languages here just with a quick click. So if you click Japanese, the whole site is going to translate over into Japanese. That will also carry over into your searches as well. And then to kick back to English, you just show original. And now you're back to English. I'm going to scroll down a little bit about midway on our homepage. We do have a few links here to our sister units. So the first one is Child Development Info Line. They are available here in our offices in Rocky Hill. They are a program of the United Way of Connecticut. They assist families who have concerns about the development of their child. This website is very rich with information. A family or a provider can make a referral right into the program directly from their website. They have a wealth of information about the ages and stages of a child's development, as well as all the programs that they work with. So if that's something that you or your clients need, we have that available right from the homepage. Additionally, we have our child care unit, 211 Child Care. They're also here with us. Both of them operate call centers, so you can call or you can search online. They have licensed quality child care providers, both home-based providers and center-based providers, and you can do the lookup right here from their website. EMPS services, if you click on that, you'll get a little more information about that project. This is an arrangement we have with the Department of Children and Families. We are the central intake for EMPS, or Mobile Crisis Intervention for Youth. So calling 211 gets you in the door for that initial service. There's also a community calendar that we have. Annie's going to speak to that a little bit later, so I'm not going to click on that right now. And then at the bottom, we have our 211 Navigator, which some of you may or may not be familiar with. This is a benefit screener for all of these programs. It is very non-intimidating. It's free. It doesn't require a social security number or birthday or anything like that. It's just household size, demographic information, and income details. Once you're done, it tells you what programs you may be eligible for. And then if you click on the program, it's going to give you more information about the program. And in just a few instances, like food stamps, it will also provide you with the application. Okay, I'm going to go back home here. The last item on the home page that I'm going to show you is the HCVP website, or Housing Choice Voucher. All housing authorities are required to post here when they have an opening for Section 8. So if you are a housing authority and you're unaware of that, this is something that we maintain here in-house, but it is a requirement to post. We always encourage folks to sign up for the posting notifications. When something comes to this website, if you're looped in to get the notifications, you just get a quick email, so you don't have to constantly keep checking back on this website, and the alert will let you know that something has been posted to the site. All right, so back to the home page. There are 3 ways to search our website. Now, our database is about 4,000 agencies large and 40,000 programs and services. So it's a very big database. We've been building this database up for over 40 years. And we wanted to make it as easy as possible for folks to look up the information that they needed. So I'm going to come back to this free text box in just a second, but I'm going to scroll here to the item that says, unsure of what you're looking for, let us help. We've actually developed needs statements. So when folks call into 211, this is how they generally present themselves. I need health insurance for myself or my family. I need transportation. They base their request on what service they need. So behind the scenes, all of these terms are embedded with referrals, programs, services that can help this particular need. So if someone kind of gravitated towards this style, this is an option. The other option is our category. So there's a few up front on the home page. If you click more categories, you're going to see some nice colorful graphics illustrating all of the categories. And when you click on one of them, we'll just take youth for an example, you're going to see a lot of information here. We've recently revised this particular category page, so we break it down by topic, and then all of these links will point you into our database. So all of the searches on any category page is going to be a statewide search. And then you can, change that up and put in a specific area if you'd like, but we just wanted to make things easier. Every category page, it's not the entire database, it's just a slice of resources related to these particular topics to get you started. Okay? Now, the free text box here, this is where you can type in a word or a phrase, a program name, an agency name, just to get you started with the search. For the sake of today, I'm going to just start typing the word food. You can get a quick snapshot of all the terms that we have associated with food, food stamps, food cooperatives. All of these are our taxonomy terms, which will auto-suggest, so it makes it a little bit easier to choose one. I'm going to choose food pantries. And if we put nothing in here, it's going to default to Connecticut, and it's going to give you a little disclaimer that says, are you sure you want to search all of Connecticut? And we really are providing the recommendation now that it's really best practice to put in a zip code for the best results. You can also put in an address. This is powered by Google, so it's going to recognize addresses across Connecticut. So today I'm going to use a zip code in New Haven. I'm going to choose it, and I'm going to click search. All right. So we have 39 resources for food pantries serving this particular zip code in New Haven. So the first snapshot here is just all the programs, all 39 programs. You get a quick little snapshot of the information. If you were on your phone, you could call, you could view the website, you can get directions, which are powered by Google. You'll see the map on the right over here. Each pin corresponds to one of these programs on the left. So if I scroll back up to the top, I'm going to show you some of our filtering capabilities. So if we show advanced filters, I'm going to choose Wednesday because let's just say I'm working with someone who only can access food on a Wednesday. We're going to filter the results. So we started at 39, and we're going to notice here that it's dropped it down to 13 resources. So a little bit more of a manageable number. And then I'm going to scroll down and find one that I think might be appropriate. So this one is Wednesdays from 12:30 to 1:30 at the Walk of Faith Church. I'm going to click more details. Scroll back down a little bit. You're going to get all the information that you need. Someone can walk in. It's free. They serve New Haven County. Here's the address, the phone number, the fax number. Let's say you work for the Walk of Faith Church Food Pantry and you notice that this is wrong. You can update with us right here from this listing. So update this listing brings you to a form that presets itself with the name of the agency and the program that you've chosen, and you just fill it out and hit submit. This comes to my department, so myself and my team get these on a daily basis, both from the website, but also a very similar process. Our call center flags resources for us as well when callers report things like, you know, you have the wrong hours for the food pantry. So this is a quick and easy way to stay current with the information for us, and we're only as good as what we're given from the providers of these 4,000 agencies. So please utilize this if you are a provider that is listed in our system. So we have this resource. Now what can we do with it? We can print this, we can share it. I'm going to just choose those options and just notice you can email this one resource, you can text this one resource, you can print it, or you can just copy the link and embed that somewhere else. So in a newsletter or on a web page or something like that. So this is one at a time. But let's say I wanted to add this and a few others to a list. I'm going to go back to the results, and I want to add this one. So those of you that have been familiar with our website since we started making changes in 2015, this language, add to list, is new. So it used to be add to cart. So we had this resource cart functionality. It functions the exact same way. We just say add to a list because we're enhancing the way that people can build up these lists. So if we do add to list, for the very first time, if I don't have a My 211 account, which we're going to dig into in just a second, it's going to give you this tip. When you sign up for an account, you can save a resource to a list and return to it later. Do you want to sign up now? Click this button or skip it. So if I thought, yep, this is a cool idea, I want to do this, I could go ahead and click create an account. And what it's going to do, the only requirements are an email address and a password. You just have to put the password in twice and then sign up. You can provide us with your name and your organization, but you don't have to. And then all the benefits to signing up for an account are right here. So really, you have the ability to build, save, edit, and share customized lists. You can create an endless amount of lists with an endless amount of resources to share with folks that you're working with. Okay, so let's just go back. And let's say you wanted to opt out, you didn't feel like creating an account today, which is fine, it's not mandatory. So you get your little tip and then you say skip, you're still gonna get a list. Just like you would have before when it was the resource cart, you can add as many as you want to this temporary list. And then when you're done, you can choose the list and you can print it or share it. Now, I want you to notice, we're going to shift gears and go into the account in a second. When you share a temporary list, you can only share it by email. You cannot share it by text, which can be a disadvantage if you're sending it off to someone through a text message. So now I am going to shift gears. I'm going to go into a different browser that's already preset. So it's the exact same search that I just did, but I signed into my account, my free My 211 account. And how do we know that that is true? Up here in the top right, it says My 211 account. So I am logged in, ready to go, ready to build up some lists. If we just drop this down here, you're going to see the options are accessing your resource list, your account settings, or you can log out. So even though I work here, I created an account and I log in every morning when I get to my desk and to my website, because I am really building up a lot of lists to share with providers that we're working with, but also to just test the system and make sure that this is working properly. I went to an outreach event where I built up some lists and I shared them right there in the moment with folks who really needed that information quickly. So I would definitely recommend to all of you to sign up. It's free. You can opt out at any point if you feel like you don't want the account, but really there's a lot of benefits to signing up. So with that, I'm going to now add to a list being signed in, okay? Add to a list. So when I want to add these pantries, I may already have an existing list. So I have some, but none of them are food pantries in New Haven that are open on a Wednesday. Okay, so because of that, because I'm sharing this list, I want to create a new list. So I'm going to say food pantries 06513 open Wednesday. Okay, so I create that list, and it does tell me that this particular entry was added. I'm going to scroll down, add to list, select a list, and it's at the very bottom, the one I just created. I just choose it and add, and it tells me it's added. I'm going to do this one more time, add to list, pick my list, here we go, and we're added. Now, we're going to access our list. Currently, I have a total of 10 resource lists, and they are filtered by the date that they were created. So this one that I just did is at the top. If I wanted to filter it by the name of the list, I could do that. But for the sake of this, I definitely want to see the date as the filter, okay? And so I'm going to open up this list. I can rename it if I needed to. I can delete it if I just really went the wrong direction and this isn't what I wanted. But I'm going to open it just to see what's in there, check myself that these are the 3 that I want to share, and they are. And then we're going to print and share this whole list. So just this quick little click. You can share it by email. As mentioned, the benefit of creating an account is that you can share this whole list by a text message. And when you get the text, it says you were sent a 211 resource list, and it gives you the unique link to these 3 options, okay? Or you can print it, or you can copy the link, which again might be beneficial if you were embedding it into a newsletter, embedding it onto your website, anything like that. So those are the options that you have with a list. And again, it's really a great thing to use when you are on the ground. So if you do home visits, you could use this on your phone. You could create lists and just ship them off right there to the person you're working with right there, you know, through a text message, through an email. Our database is completely mobile friendly and location aware. So all of this will work if you were on your phone. And really what I have been thinking about lately is that utilizing this tool, building up these lists and sharing these lists, is really putting all of you in a position where you can essentially be doing taking the steps that our contact center staff do when they make referrals through 211. They use a zip code, they use the service terms, the taxonomy terms, and they are providing these referrals, oftentimes, you know, many referrals at a time. So you basically can assume that same role if this lends itself to the work that you're doing. Okay, so I am actually going to segue over to our professionals page, and then I am going to pass the mic over to Annie. So our professionals page is right at the top navigation bar. There's a few things that can be accessed here. I'm just going to speak to one very quickly, and then I'm going to let Annie continue. So as I mentioned, within a resource, you can update the listing right there, which comes to my department. You can also do that here from the professionals page. So this is an agency update form. And if you wanted to add your agency or your program into our database, if you're not yet represented, we do have intake forms for that as well. So food pantry or soup kitchen form, home care agency, support group. And then this last one is if you are a nonprofit organization with multiple programs and services, that's the one you would want to click. Our inclusion-exclusion criteria is also found on this page. We generally accept nonprofit organizations into the database, but for the full details of our process for deciding what agencies can be listed, you can click there for more information. So thank you all for listening to that demo. I'm going to pass it over to Annie.
Hey, thanks so much, Kate. And hi, everyone. It's Annie Scully again. So I'm going to quickly just give you an overview of this professionals page. We intentionally invited a lot of professionals to join this webinar today. And so I want to take a minute just to focus on this page, which is really, constantly updated to benefit you and to be as user-friendly and helpful in your day-to-day work as possible. So you'll see that on the right side of the screen, it says, how can we help, how we can help. And these are all sort of links that can help you to help the people that you serve daily. I'm going to start by talking about our 2-in-1 materials. If you click right here on Order 2-in-1 Materials, it will allow you to preview a number of different brochures, bookmarks, posters, wallet cards that we offer for free. So if you are interested in having materials either to pass out to those that you serve or at a desk of your storefront, you can absolutely do that right here. If you're not sure which ones you're looking for, you can quickly preview each material, and it will give you a quick snapshot of what those look like. Many of the materials we have are bilingual, or they're multilingual, which means that they're Spanish and English on one side, which is a nice feature. There are also some links for some of our flyers. So our 2-in-1 Counts flyer, which I'm going to go into a little bit later, and our web features flyer. So that will also highlight our new My Accounts, My 2-in-1 account, and also just give you an overview of all the ways to search that Kate covered earlier. So if you're interested in having that handy to pass out or to refer back to, you can go ahead and download that flyer right here. If you find out that you are interested in ordering materials, you can go ahead and quickly click here, and it's a pretty basic order form. All you have to do is enter the quantity of each item that you'd like after you've previewed them, and then we ask that you give us your name and your address so that we can send those materials to you for free. The next thing I want to talk about is our reports, so our publications and reports that we have available on the professionals page. Clicking publications and reports on the right side of the screen, it'll give you an overview of a number of different resources that we make available. So once again, there's a link for our 2-in-1 Counts data dashboard, which I'll go into a little more detail later. But there's also a link to a couple of our monthly publications. Our 2-in-1 Data Glance, which is a brand new publication. We just started putting it out 2 months ago. So it's meant to be sort of an overview of our database. So as Kate alluded to, we have more than 40,000 programs and services that are continuously updated in our database. And this Data Glance is meant to highlight some of the new additions to that database. They might not be new to Connecticut, but they're new for us. And we're constantly updating the database to reflect the needs of the communities. So if we find out that resources aren't being utilized or are no longer a priority, we might prune those out of our database and then update those with newer resources. To give you a quick overview of what that looks like, I'll click on our April edition. And it really is a very brief publication with links directly into our database. So if you realize that you're interested in learning more about one of these, or you want to create an account and add these to your resource list, clicking on any one of these links will draw you right into our 2-in-1 database. Our other publication is our Community Connection newsletter that also is sent out monthly. And if you're interested in having timely information about community events across the state, you can go ahead and sign up for that newsletter. It's intentionally brief. It features between 3 and 5 different events or different initiatives across Connecticut, and it's meant to just raise awareness about what's going on and provide information about activities in your communities. If you're interested in signing up for either of those, you can go ahead and click here, and there's a quick form that you can fill out, and we'll go ahead and add you to our distribution list. We also send out timely e-bulletins, which are about events that are happening, and this is a deeper dive into some of those events that are happening or some of those initiatives that are happening that provide links to additional information. And finally, our 2-in-1 Barometer, which is meant to highlight some of the needs across Connecticut and also focus on the data that we collect here at 2-in-1. So every day we field thousands of calls from Connecticut residents and thousands of people utilize our website. And this 2-in-1 Barometer sort of gauges what the needs of the communities are and kind of looks at to where referrals are being made and whether or not those referrals are effective. So the transportation barometer came out in 2017, and we put about 1 or 2 of these out annually. So if there's a topic that you're interested in, go ahead and check here, and you can always shoot us an email if you have an idea about an interesting topic that we should look closely into. So I'm gonna go ahead and go back to our professionals page and talk to you about our community calendar, which Kate showed you. There's a link for it right on the home page, which is new, but you can also view the calendar here. If you click on view, it will bring you to our community calendar, and you'll see that at the very top, you can go ahead and filter by date or by keyword, or you can narrow your search results by category. There's a drop-down menu, which provides some options there. So if you're only looking for information or events that are taking place on employment, you can go ahead and click employment. You can also search by day. If you know that you're working with a group of clients that are only available to attend afternoon activities on a Wednesday, you can filter the events on this calendar by day or by location. We try to maintain this calendar and have it be as saturated as possible, so we encourage you to check back as often as possible. We're constantly updating it with new events across the state. And we also encourage you to submit calendar items if you're interested in having something published on our calendar. You'll see at the top there's some guidelines for submission. So it must be an agency. In order to be included on our calendar, it must be an agency that's included in our database, and it must be an event that's free and open to the public. We really try to make an effort to have these activities be vetted by us, and we know that all the agencies listed in our database are ones that we trust making referrals to, but also want to make sure these events are open to anyone. So open to the public and free are 2 criteria that we try to adhere to. And there is also a link to submit a calendar item right on the professionals page. So the last item I'm going to talk about is our 211 Counts data dashboard. So 211 Counts data dashboard is a real-time dashboard that provides information at the state and as specific as zip code level for our community needs across the state of Connecticut. It's a real-time tool that provides searchable and visual presentations of our 211 call center data across 13 categories. So if you look at the top left-hand corner, you'll see those 13 categories, and then across 76 subcategories. So each one of these top categories, housing and shelter, food, utilities, also have a number of subcategories, so you can drill a little bit deeper into each one of them. For example, if I'm on food, I can go over to the top right corner, and you'll see there's an item for help buying food, food pantries, soup kitchens, feeding children, home delivered meals, and so on. A great feature that I like to point out is if you hover over one of the category titles, it will give you a little bit of description about what that actually means. So for food, when we talk about food, we're talking about help buying food, finding places to pick up food, or to eat free or low-cost meals. Same with the subcategories. If you want to know a little bit more about that topic, you can go ahead and hover over it and we'll give you a brief description. As I said, this is provides searchable and visual presentations. So if you know you're only interested in looking at a certain town or city, congressional district, or state house district, you can go ahead and you can filter these results by location. If you come to 211ct.org, ct.211counts.org, it will automatically display information for the entire state of Connecticut for the last 365 days. So you'll see at the top it says all, which is all of Connecticut, and then last 365 days. You'll also see at the top it says total calls and total requests. When an individual calls 211, it's logged as an individual call. However, that conversation may result in multiple requests for service. So if I'm calling, I might be interested in where there's a career fair or where there's information or help that I can have to help find a job. But it also might turn into me saying, oh, by the way, I'm in between employment, I'm having trouble paying my bills, I need help accessing food. So that conversation between me and a call specialist could result in multiple requests for service. So the total request represents each individual request, and those are also the results or the data points that we chart on this data dashboard. You can display the data by percent, which is how we're currently showing it, or by count. So if I want to see not just percent, but the number, we can go ahead and we can flip over to count, and it will say that there was 92,551 requests for service in housing and shelter in the last 365 days in Connecticut. But once again, if we want to go ahead and filter those results, we can choose a location. So let's say I'm only interested in Hartford. I can go all the way to the right, type in Hartford, click check, and search. And I want to know how many requests came from Hartford in a custom date frame. So I can go ahead and click on last 365 days. There's an arrow right next to it. click on custom date, and I just want to see for the month of April. So I'm going to go April 1 to April 30, click the arrow, and all of the data on this page will be updated to only reflect requests that came from Hartford between April 1st and April 30th. If we scroll down a little bit, I'm going to point out a couple of more areas on this data dashboard. First, there's a map, which shows by location the concentration of need. So for Hartford, we can see that there's a high concentration of need for food resources over the past month. This map is also overlaid with census data, so it will say, you know, the rate of poverty, the rate of unemployment, the percentage of people that do not have a high school diploma, and the percentage of people that are renting. And you'll see that on the top of the bar here, the top of the map here. You can also flip over from region to zip code pretty quickly. So if you click zip code, it will break the city of Hartford into the multiple zip codes that encompass that city. I'm going to go ahead and I'm going to default back to the entire state. And you can see that you can also quickly look at trends across the state for various topics. So right now I'm highlighting food, and you'll see that the darker colors represent a higher concentration of need or a higher concentration of calls that the 211 call center has received, and the lighter shades represent a lower concentration of need. To the right, there's also some requests by time. So this top spark line shows, you know, month by month. If you kind of go ahead and scroll over, and it compares last year, which is in blue, to the prior year, which is in orange here. So you can go ahead and you can sort of map trends. There's also a place that you can look at individual categories for trends. So this is just showing food requests, whereas the top chart is showing all requests over that 1 month period. So we hope that 211 counts can be used to establish trends and help identify state and community specific needs. Once again, you can filter by zip code, by municipality, by congressional district, or by custom time frame. And we're hoping that it will help interested parties, stakeholders, and decision makers analyze call data as recent as yesterday, study trends, make comparisons, and share information. We're constantly updating this data dashboard and trying to make it as robust as possible. And a recent addition that was made was the ability to filter by demographic. So if you click on the little people that are right next to the topic, you'll see two little sort of figurines. You can click and it will drill down into that category and show you need by demographic or request by demographic. So we can see that, you know, just over 68% of requests for food in the month of April came from females. And we can also look at age. So a breakdown by, you know, what age group was making those requests. Another feature that was added is the ability to look at unmet needs. So all the way to the right, we're going to highlight housing and shelter. You can see that there's an unmet need category. And once again, if you hover over that, it will give you a little description as to what that means. And this is the percent of requests for which no help was available. So when we say no help was available, what that means is that if someone called 211 seeking rental assistance, as you can see, 80% of requests in the month of April were unmet for rental assistance. So that means that there was no resource in our database we could match an individual with to receive that help that they needed. And if we kind of do some thinking here, we know that's because the state's rental assistance program is not currently operating. The waiting list is closed and there's no resource to effectively connect people with. But that could also mean that the individual wasn't able to access a resource. So if they had a transportation barrier, if you know, their eligibility requirements were such that they were too old or they had income that was too high to access that resource, we would also check that as being unmet because we don't have a resource that we can effectively or efficiently connect someone with to meet their need. So unmet needs is another category that we like to track as well. So as you are, you know, doing research in your communities and trying to map assets and quantify needs, 211 counts is a great resource. And we hope that you guys can utilize it. On the far left side of the screen, you'll see some additional tabs. So you can go ahead and you can share information on Facebook or Twitter. You can email this information to yourself, and you can also print detailed and brief reports. So if you want to go ahead and click on that, it will generate a PDF of all the information you see on this screen that you can have on hand to refer back to. And finally, you can take a screenshot. If you know you want to see that map as an image, you can go ahead and you can take a screenshot of that image and have that available for a later date. So right now, I'm going to go ahead and sort of wrap up the webinar, and we're going to go ahead and field questions. I see one quick question that's fantastic that I forgot to mention earlier. This webinar is being recorded and will be available on our professionals page. I'm going to quickly go back to that professionals page and show you where it will be available. And as I also mentioned earlier, there will be a quick follow-up email that all of you will receive that will have a link to take a quick survey about what we can do to continue to improve and what your thoughts are on some of our new features. So you'll see this professionals page has a link for 211ct.org training videos. And if you click here, hopefully later this afternoon, we'll have this webinar available that you can go ahead and you can refer back to, or you can share with your colleagues that maybe weren't able to attend the webinar this afternoon, or this morning, I should say. So once again, we would like to open it for questions now. Please feel free to chat your questions and we'll do our best to answer them for you. I see one that came in a little bit earlier from John, and it says, can users make the left side larger and make the map smaller when using the site and searching?
Thanks, John. That was a very good question. I think currently that is not an option, but I definitely will take it back to my team and see if that's something that can be altered a little bit, because the map is certainly large and in charge, but and if the resource side is a little too small, then we want to make sure that we investigate that. So thank you for that question. If I can get an answer, I will certainly try to reach back out to you and let you know if that is something that's possible.
And also, John, just to piggyback on that, if you choose to print your results, it will come in a PDF and it will show just that resource card. The map won't be included. So if you want to have that as a full size to be able to hand out, choosing that option to print is a great way to do that.
So we have a few more questions coming through. We're just trying to get a grasp on them. So we will read them out one by one.
So we have a question from Amanda. Is it possible to save custom geography in the 211 monitor? So agency service area equals a couple of specific towns.
So I think, Amanda, if I'm understanding you correctly, if your agency is represented, so the program serves, you know, five towns, we do capture that information as reported to us by the agencies, and that's always available in the details. If for some reason you're looking up your agency record and you don't see that, it's a quick fix. You just update the listing and let us know, and we'll add it or change it if we happen to have it wrong. So some services go by the whole state, some services go by county, and then sometimes it's as small as just one zip code being served. So yes, we capture that. I hope that answered your question, Amanda. It looks like Sandy had a question. Let's see, can you present the webinar in person to a large group in case there are any questions? Yeah, so as mentioned up top, I mean, if anyone who's attended today wants an in-person presentation or, you know, a remote webinar presentation, Annie and I can certainly work with you to get that set up. Absolutely. Just drop us an email or give us a call and we can try to schedule something. Absolutely.
There was also one other question from Amanda about having trouble directing search by location. And one thing we should maybe make clear is that when you search a location, the list that is generated is for resources that serve that area. They're not necessarily located in that area. And so what that might mean is some manual sort of filtering of that list. If you know that you're working with a population that has transportation barriers, it might be smart to take those resources that aren't located in a place they can access. And Kate's going to go ahead and show you kind of what I'm talking about right now. So great question, Amanda.
Yes. So I'm just going to do New London. I'm just using food pantries just as an easy example. And so I think, Amanda, you maybe understand our filtering a little bit. So some of these advanced filters, so we just have New London in here, and there's 10 resources, but there is a filtering option of radius. So you could do within 1 mile of the location that you've entered, 5, 10, 25, 50, etc. So if we just try this, I'm not certain how the results are going to look here, but within 1 mile, it just drops it down by, I think, by 1. So that filter is something that you can certainly utilize at any point, but we do, like earlier, we mentioned that using a zip code is probably the best practice at this point in time, just to really narrow it down. But if that's too limiting, then you can certainly clear it out. You can do just, you know, the town, you can do the whole state, whatever, you know, you might need in that moment. So I hope that that kind of clarified things a little bit. I'm just looking here. We're having a few more questions. Hold on.
One quick question is, can you filter the unmet need by age or gender? And Stephanie, that's a great question. And those are sort of internal custom reports that we can run. So if you're, you know, focused on a certain demographic of people and a certain area of need, you can absolutely reach out to me or anyone here at 211, and we can run internal reports to give you some additional information about why those needs were unmet and who's unable to access resources. So please feel free to shoot me an email or give me a call, and we can follow up on that question.
And I just want to say thank you all for the very kind comments that you are providing. We really appreciate that. We appreciate your attendance. We have another question here. I think it's a piggyback to Amanda's original question. So this would be if someone could drive 5 miles to another location. So with the Google functionality being embedded into the resources, if you wanted to get directions to this particular food pantry, Google allows you to do that by driving directions, transit, walking, bike, even plane. So it really is a nice way to provide your clients with some direction, because some folks don't have a car, some folks may choose not to use public transit, and they are always on foot. So those directions would be useful for them if needed. So just know that you always have that option from any resource.
We have one other question. It says, are there places in New Haven open to walk-ins for homeless men and women? Are there any churches open to the homeless daily? And that is a great question. We are the front door for the state's coordinated access network. So anyone that's in a housing crisis or facing homelessness should absolutely call 211, and a contact specialist can help get them connected with a housing resource as soon as possible, and then hopefully transition them into a more permanent housing solution. But Kate really quick is going to show you another way to do it on our website as well.
So Pamela, the term that we use is homeless drop-in centers. I'm just going to use all of New Haven, and it looks like there are a few. So if this is something that you wanted to look up and add to a list or share with someone, just use the terminology homeless drop-in centers serving New Haven, and it looks like there are 3. Okay. And then Sherry asked, will 211 host for consumers as well as professionals? Absolutely. Hi, Sherry. Thank you for that question. We are open to that. We do go out sometimes to groups where it's like parent groups or consumer-run groups. So we will present to those groups, absolutely, as long as we have the staffing and the capacity to do that. But the benefit of this webinar and others being recorded and being on our public website is that anyone can access them. You don't have to be a professional. You can access the webinar anytime. So thank you for that question.
We have one other question about someone that's located in Fairfield County, and they just want to be assured there are resources for me in that direction. And absolutely, our database reflects resources that are statewide. So as Kate said, by zip code is the most effective way to search. So if you have a specific need that you're interested in looking at, you can go ahead and populate the zip code that's applicable and then type in that search term. I would also follow up to that to say, if you're searching the website, and we've given you the overview today and the demo, and hopefully it was useful in terms of learning how to use the website, but we have so many programs and services in this database that it can be overwhelming. And if you're new to searching and you need a little bit more guidance or support around that, please feel free to reach out to me. I'm happy to talk someone through searching and give some guidance on taxonomy terms and things like that. So don't hesitate to do that. We also have a quick question about concerns that 211 takes personal information, and I'll let Kate go ahead and answer this question.
Yeah, sure. So when someone calls into 211, our staff are required to take some information, primarily zip code, household size, income, because they will do screenings for the state and federal programs. As of late, we have added additional screening questions around ethnicity, which folks do not have to answer that question. It is optional, but it is something that we were required to add into our assessment. So that may have been sort of the personal question that someone you were talking to had mentioned, but know that it certainly is not mandatory at all. And really the basis for asking those screening questions is to gather the data that helps to populate things such as 201 counts, like Annie showed you, and all of the reports that we do both for local partners and also nationally with some of our partners nationally. So
we had another question about are there resources for customers for identity theft? And Kate talked quickly about our e-library earlier. It's a database of white papers that has about 450 papers. So we do have a page on identity theft. So if you go to e-library at the top of the screen, you can actually search identity theft, and this is a sort of a great place to start to gather information about identity theft. There's links to federal and statewide resources as well, and it talks you through how to detect identity theft and then how to go on and report that.
Thanks, Annie. Yeah, so our e-library has about 440 papers. I will just show you really quickly the categories. So e-library, and then we show you what papers are new, and then all of our categories here will point you into all of those specific papers that can be printed. They can be created into a PDF. We update these at least one time per year. They've been growing for the last 20 years in terms of writing new papers and getting rid of old papers. So please feel free, you know, in your spare time to peruse our e-library if you need some topic-specific information. So just to recap, the webinar is being recorded. It will be on our website in just a short time on our professionals page under 2-on-1 training videos, which is being put up on the screen right now. The link can be shared. So the question is a webinar like this recorded somewhere? I would actually wait, Amanda, just for a couple hours. We're going to have it up and you can share it from that point. The one that's up here, Annie and I did this one a few months ago, so it's still fairly relevant, but let's, I will say wait a couple hours, and then this new one from right now will be up there. I'm just checking here a few other questions. Oh, our contact info. Yep, we'll put our contact info back up in just 2 seconds. Let's see. Yes, we will, sorry, we will place a date on the webinar so that it's clearly identified that this was today's. I do just want to address one other question Stephanie asked you, track sexual orientation, gender identity. I am pretty sure that the answer to that is no. So if I find out that I am wrong on that, I will let you know, but I'm pretty sure the answer to that is no, unless it is necessary if someone is having, you know, a discrimination case against them in housing, or they need an attorney for another issue related to that, or if it's a specific, like let's say counseling service related to someone and their sexual orientation or gender identity. Questions are coming in. When you share a list via text to a mobile, does recipients have to have a My 2-in-1 account? That's an awesome question, and the answer is no, they do not. So you can send text to anybody, and they can access them no problem, because what it does is it just links them into the live database, irregardless of whether they have an account or not. That was an awesome question, John. Thank you. Let's see.
We have a question, are there free tutors for ADHD children in 4th to 8th grade? That's another great question, and starting with our database is a great way to go ahead and filter through some possible resources for that need. And I think Kate is gonna, I'll try to queue it up quickly just for the sake of time. I know we have some topic-specific questions that I will try to address. If we run out of time, I will encourage you to reach out to me directly for sort of the more topic-specific questions. But we do have tutoring services is the term that you would use, so I'll give you that guidance, Pamela, to use that particular term, and then search it how you need to, and then just check the details to see what age or grade level is being served. And then I have a question here, how centers are in New Britain and when are they open till daily? I would love to answer that question, but I'm not sure what types of centers you're referring to.
So if you can clarify, that's great. Maybe it was homeless drop-in centers as well, a previous question related to that, but if you can clarify, we can try to answer. We'll take questions for maybe just 2 or 3 more minutes.
Absolutely. And just so quickly, we'll pop back up our contact information, which was a great question earlier. So that if you do have any follow-up questions or you think of something later on today, please feel free to either call or shoot me or Kate an email. This is our contact information right here.
Mm-hmm. And I'm just going to make sure that we have answered all of these great questions. We really appreciate everyone's attendance, and the fact that you're asking such great questions is awesome. So thank you.
And just to once again remind you guys, this webinar is being recorded. It will be available through our professionals page. And everyone that was in attendance today will also receive a follow-up email with a quick poll and the opportunity to sign up for information about additional webinars. So if you have 5 or 10 minutes to take that, we'd really appreciate it. And thanks again for your great questions and your awesome feedback.
Yeah, so we did get a little clarity on that last question. So it was about homeless drop-in centers and food pantries. So I would certainly say to check those 2 terms, homeless drop-in centers and food pantries, and then just plug in New Britain or a zip code in New Britain, and you will get all the resources in that particular area that serve residents of New Britain. Okay. So we'll wait 1 more minute, and then I think we'll close down the webinar. We hope that this has been a productive use of your time today. It certainly has been great for us to be able to share this information with you. We are thrilled that everyone is using the website. And again, reach out to us at any point if you have any additional questions. We do have 1 question about chat. I don't have a specific date yet, but I think soon the chat feature will be back up and running on the website. And as soon as that's up, it'll say chat available, and you can click it and start that conversation. I'm sorry I don't have a specific date for that, but hopefully within the next couple of months, that may be back up. Okay. So we hope all of you have a fantastic day. Thank you again. And reach out to us when you need us, okay? And have fun using the website.
Yeah, thanks, everybody. We appreciate you joining us this morning.